Hi everyone, my name is Janmaj and today is day 34th of my communication practice and we were part B of the book called Man's Search for Meaning by Viktor E. Frankl, and part B, the author talked about logotherapy and we got to know the logotherapy and how it has impacted what kind of things we are looking for in logotherapy. So it's basically about finding out meaning in life and talking to people and then telling them to find to search and go into the pursuit of finding the meaning for life. And right now there are a lot of stuff that the author has covered, like it's kind of 360 profiling of the human. It's different from psychoanalysis, but it has some sort of same sort of fundamentals. So I'll just like start reading. Life's transitoriness. Those things which seem to take meaning away from human life include not only suffering but dying as well. I never tire of saying that the only really transitory aspect of life are potentialities. But as soon as they are actualized, they are rendered realities at the very moment. At that very moment, they are saved and delivered into the past, wherein they are rescued and preserved from transitoriness. For in the past, nothing is irretrievably lost, but everything irrevocably stored. Thus, the transitoriness of our existence in no way makes it meaningless, but it does constitute our responsibleness, for everything hinges upon our realizing the essentially transitory possibilities. Man constantly makes his choice concerning the mass of present potentialities. Which of these will be condemned to be non being, and which will be actualized? Which choices will be made an actuality once and forever? An immortal footprint in the sand of the time. At any moment, man must decide, for better or worse, what will be the moment of his existence. Usually, to be sure, man considers only the stubble field of transitoriness and overlooks the full granaries of the past, wherein he had salvaged more once and more of all his deeds. His joys and all his sufferings, nothing can be undone and nothing can be done away with. I should say, having been the surest kind of being. Logotherapy, keeping in mind the essential transitoriness of human being, is not only pessimistic but rather activistic. To express this point of figuratively, we might say the pessimist resembles a man who observes with fear and sadness that his wall calendar, from which he daily tears a sheet, grows thinner with each passing day. On the other hand, the person who attacks the problem of life actively is like a man who removes each successively from his calendar and files it neatly and carefully away with its predecessors after having first jotted down a few diary notes on the back. He can reflect with pride and joy all the richness set down in these notes on all the life he has already lived to the fullest. What will it matter to him if he notices that he is growing old? Has has he any reason to envy the young people whom he sees, or wax nostalgic over his own lost youth? What reasons has he to envy a young person for the possibilities that a young person has, the future which he store for him? No, thank you, he will think. Instead of possibilities, I have realities in my past. Not only the reality of work done and of love loved, but the of suffering bravely suffered. These sufferings are even the things which I am most proud. Those, though these are things which cannot inspire envy. Logotherapy as a technique. A realistic fear, like fear of death, cannot be tranquilized away by its psychodynamic interpretation. On the other hand, a neurotic fear such as agoraphobia cannot be cured by philosophical understanding. However, logotherapy has developed a special technique to handle such cases too. To handle what is going on, whenever this technique is used, we take as a starting point a condition which is frequently observed in neurotic individuals, namely anticipatory anxiety. It is characteristic of this fear, it produces precisely that of which patient is afraid, An individual, for example, who is afraid of blushing when he enters a large room and faces many people will actually be more prone to blush under circumstances. In this context, one might amend the saying, the wish is father to the thought, to the fear is mother of the event. Ironically enough, in the same way that fears brings that to pass which one is afraid of. Likewise, a forced intention makes impossible what one forcibly wishes. This excessive intention or hyperintention, as I call it, can be observed particularly in such cases of sexual neurosis. The more a man tries to demonstrate his sexual potential or a woman's her ability to experience orgasm, the less they are able to succeed. Pleasure is and must remain a side effect or byproduct and is destroyed and spoiled to the degree to which it is made a goal itself. So we talked about never focus about goal in some other book as well. In addition to excessive intention, as described above, excessive attention or hyper reflection, as it is called in logotherapy, must be pathogenic, that is, lead to sickness. The following clinical report will indicate what I mean. A young woman came to me complaining of being frigid. The case history showed that in her childhood she had been sexually abused by her father. However, it had not been this traumatic experience in itself which had eventuated in her sexual neurosis, as could easily be evidenced. For it turned out that although through reading popular psychoanalytical literature, the patient had lived constantly with fearful expectation of the toll which her traumatic experience would someday take. The anticipatory anxiety resulted both in excessive intervention to confirm her femininity and excessive attention centered upon herself rather than upon her partner. This was enough to incapacitate the patient for the peak experience of sexual pleasure, since the orgasm was made an object of intention and an object of attention as well, instead of remaining an unintended effect of unreflected dedication and surrender to the partner. After undergoing short term logotherapy, the patient's excessive attention and intention of her ability to experience orgasm had been re reflected to introduce another logotherapeutic term. When her attention was refocused towards the proper subject, that is, the partner, orgasm established itself spontaneously. Logotherapy bases its technique called paradoxical intention on the twofold fact that fear brings about that which is afraid of, and that hyperintention makes impossible that one wishes. In German, I described paradoxical intention as early as 1939. In this approach, the phobic patient is invited to intend, if even if only for a moment, precisely that which he fears. Let me recall a case. A young physician consulted me because of his fear of perspiring. Whenever he expected an outbreak of perspiration, this anticipatory anxiety was enough to precipitate excessive sweating. In order to cut this circle formation, I advised the patient, in the event that sweating should recur, to reserve deliberately to show people how much he could sweat. A week later, he returned to report that whenever he met anyone who triggered his anticipatory anxiety, he said to himself, I only sweat a quart before, and now I'm going to pour at least 10 quarts. The result was that after suffering from his phobia for 4 years, he was able, after a single session, to free himself permanently of it within a 1 week. The reader will note that this procedure consists of a reversal of the patient's attitude in as much as his fear is replaced by paradoxical wish. By this treatment, the wind is taken out of the sails of the anxiety. Such a procedure, however, must make use of specifically human capacity for detachment inherent in a sense of humor. This basic capacity to detach one from oneself is actualized whenever the logotherapeutic technique called paradoxical intention is applied. At the same time, The patient is enabled to put himself at a distance from his own neurosis. A statement consistent with this found in Gordon W. Alport's book, The Individual and His Religion. The neurotic who learns to laugh at himself may be on the way to self management, perhaps to cure. Paradoxical intention is the empirical validation and clinical application of Alport's statement. A few more case reports may serve to clarify this method further. The following patient was a bookkeeper who had been treated by many doctors in many clinics without any therapeutic success. When he was admitted to my hospital department, he was in extreme despair, confessing that he was close to suicide. For some years, he had suffered from a writer's cramp, which had recently been so severe that he was in danger of losing his job. Therefore, only immediate short term therapy could alleviate the situation. In starting treatment, Dr. Eva Cordera recommended to the patient that he should just do the opposite of what he usually had done, namely, instead of trying to write as neatly and legibly as possible, to write the worst possible scrawl. He was advised to say to himself, "Now I will show people what a good scribbler I am." And at that moment, in which he deliberately tried to scribble, he was unable to do so. "I tried to scrawl, but simply couldn't do it," he said the next day. Within 48 hours, the patient was on his way, freed from his writer's cramp, and remained free for observation period after he had been treated. He is a happy man, again, and fully able to walk. A similar case dealing, however, with speaking rather than writing was related to me by a colleague in the laryngological department of the Vienna Polytechnic Hospital. It was the most severe case of stuttering he had come across in many years of practice. Never in his life, as far as the stutterer could remember, had he been free from his speech trouble, even for a moment, except once. This happened when he was 12 years old and had hooked a ride on a streetcar. When caught by the conductor, he thought that the only way to escape would be to elicit his sympathy. So he tried to demonstrate that he was just a poor stuttering boy. At that moment, when he tried to stutter, he was unable to do it. Without meaning to, he had practiced paradoxical intention, though not for therapeutic purposes. However, this presentation should not leave the impression that paradoxical intention is effective only in a monosymptotic cases. By means of this logotherapeutic technique, my staff at the Vienna Polytechnic Hospital has succeeded in bringing relief even in obsessive compulsive neurosis of a most severe degree and duration. I refer, for instance, to a woman of 65 years of age who had suffered for 60 years from a washing compulsion. Dr. Eva Cordera started logotherapeutic treatment by means of paradoxical intention, and 2 months later, the patient was able to lead a normal life. Before admission to the neurological department of Vienna Polytechnic Hospital, she had confessed, "Life was hell for me." Handicapped by her compulsion and bacteriophobic obsession, she finally remained in bed all day, unable to do any housework. It would not have been accurate to say that now she is completely free of symptoms, for an obsession may come to her mind. However, she is able to joke about it, as she says, in short, to apply paradoxical intention. Paradoxical intention can also be applied in cases of sleep disturbance. The fear of sleeplessness results in hyperintention to fall asleep, which in turn incapacitates the patient to do so. To overcome this particular fear, I usually advise patient not to try to sleep, but rather to try to do the opposite, that is, to stay awake as long as possible. In other words, the hyperintention to fall asleep arising from the anticipatory anxiety of not being able to do so must be replaced by the paradoxical intention not to fall asleep, which soon will be followed by sleep. Paradoxical intention is no panacea, yet it lands itself as a useful tool in treating obsessive compulsive and phobic conditions, especially in cases with underlying anticipatory anxiety. Moreover, it is a short term therapeutic device. However, one should not conclude that such a short term therapy necessarily results in only temporary therapeutic effects. One of the most common illusions of Freudian orthodoxy, to quote the late Emile A. Guthiel, is that the durability of the results corresponds to the length of therapy. In my files, there is, for instance, the case report of a patient to whom paradoxical intention was administered more than 20 years ago. The therapeutic effects proved to be, nevertheless, a permanent one. One of the most remarkable facts is that the paradoxical intention is effective regardless of the etiological basis of the case concerned. This confirms a statement once made by Edith Weisskopf Joelson. Although traditional psychotherapy has insisted that therapeutic practices have to be based on findings on etiology, it is possible that the certain factors might cause neurosis during the early childhood, and that entirely different factors might relieve neurosis during adulthood. As for the actual causation of the neurosis, apart from constitutional element, whether somatic or psychic in nature, such feedback mechanism as the anticipatory anxiety seem to be major pathogenic factor. A given symptom is responded to by a phobia. The phobia triggers the symptom, and the symptom in turn reinforces the phobia. A similar chain of events, however, can be observed in obsessive compulsive cases in which the patient fights the idea which haunt him. Thereby, however, increases their power to disturb him. Since pressure precipitates counter pressure, again the symptom is reinforced. On the other hand, as soon as the patient stops fighting his obsessions and instead tries to ridicule them by dealing with them in an ironical way, by applying paradoxical intention, the vicious circle is cut, and the symptom diminishes and finally atrophies. In the fortunate case where there is no existential vacuum which invites and elicits the symptom, the patient will not only succeed in ridiculing his neurotic fear, but finally will be able to succeed completely ignoring it. As we see, anticipatory anxiety has to be countered with paradoxical intention. Hyperintention as well as hyperreflective have to be counteracted by dereflection. Dereflection, however, ultimately is not possible except by patient's orientation towards his specific vocation and mission in life. It is not the neurotic self-concern, but the pity or contempt which breaks the circle formation. The cue to cure is self-transcendence. So basically, this was the basically logotherapy in action. Basically, here it was a long cycle where the author was explaining the logotherapy as a technique where we talked about the paradoxical intention. And yeah, this was day 34 of my communication practice, and I'll see you in the 35th video. Thanks for watching. Bye.